At the moment, the world is threatened by the pandemic named as COVID-19. This is a project done to promote the information given by the World Health Organization to ensure the awareness of our community regarding the steps taken by the United Nations for this crisis. In this video, we will be looking at part 1 of the COVID-19 calendar, from the 31st of December 2019 to the 21st January 2020. At the close of 2019, the World Health Organization's China country office was informed of a pneumonia of unknown cause, detected in the city of Wuhan in Hubei province, China. According to the authorities, some patients were operating dealers or vendors in the Hunan seafood market. Staying in close contact with national authorities, WHO began monitoring the situation and requested further information on the laboratory tests performed and the different diagnoses considered. On January 10th, developed with reference to other coronaviruses, such as SARS and MERS, the WHO issued a tool for countries to check their ability to detect and respond to a novel coronavirus. This information is to help with identifying main gaps, assessing risks and planning for additional investigations, response and control actions. Two days later, on January 12th, China shared the genetic sequence of the novel coronavirus, which will be very important for other countries as they develop specific diagnostic kits. On the next day, officials confirmed a case of the novel coronavirus in Thailand. The World Health Organization, while working with officials in Thailand and China, reported the confirmation of a new strain of coronavirus in a person in Thailand. The traveler from Wuhan, China, was identified by Thai officials on January 8th and hospitalized that day. The possibility of cases being identified in other countries was not unexpected, said WHO on Monday, and reinforces the call for ongoing active monitoring and preparedness in other countries, said the UN Health Agency. A week later, the delegation observed and discussed active surveillance processes, temperature screening at Wuhan Xi'an Airport, laboratory facilities, infection prevention and control measures at Zhongnan Hospital and its associated fever clinics, and the deployment of a test kit to detect the virus. The delegation also discussed public communication efforts and China's plan to expand the case definition for the novel coronavirus, which will build a clearer picture of the spectrum of severity of the virus. At the end of the visit, the Chinese government released the primers and probes used in the test kit for the novel coronavirus to help other countries detect it. Chinese experts also shared a range of protocols that will be used in developing international guidelines, including case definitions, clinical management protocols, and infection control. This brings us to the end of part 1. You can access more information on the official websites of the United Nations and World Health Organization. Until we meet again in part 2, be sure to keep clean and stay safe.